Sinai is a special place. It's a place that really is a very vibrant and diverse community. It's team members who are passionate about what they do. They're passionate about our community, and they're passionate about each other.
Every time I've come here, from my interview to now being in this role, it's just everyone's very friendly. There's just a feeling of being welcome whenever you come into our site, and I think that's one of the things that sets Sinai apart from some other larger campuses.
I worked at Aurora Sinai for about 11 and a half years and then left for a brief time to go to a different hospital. I came back here for an interview to potentially come back, and I was walking down the hall, and before I could even say hello, that one of the maintenance people said, "Hi, how are you today?" And I thought, I am home.
I think Sinai is unique for the patients that it serves. I think we serve a really great, unique, diverse group of people, and we get to know them, and we get to know their families, and we get to know generations of families, getting to know all those people, and then knowing that we are the community hospital, our patients know the team members that we work with. So if they have to go to a different department, we know the person they're seeing, they know the person that we're seeing, and sort of turns very collegial.
I think that it is beneficial for those that maybe have not been as exposed to other cultures to experience what it's like to care for a population that's underserved. I think it's enlightening, and a lot of us need enlightenment, and this is a perfect opportunity to get that by being here at Sinai and serving this population.
I think it's an atmosphere of learning and of continuous quality improvement. Having students here questioning everything that we do helps you really think about whether what you're doing is the best thing for the patient at any given moment. It means that all of our faculty really need to stay up to date on what is the latest evidence-based medicine.
We have a lot of different programs that really meet the needs, the unique needs of our community. A couple to think about is our women's program. Sinai really specializes in high-risk pregnancy and all things that come along with that.
So labor and delivery, women's health at Aurora Sinai is excellent care. If we're going to talk about evidence-based medicine, or we're going to talk about really providing a high level of care, that's in the midwife care that we provide, the general OBGYN, the obstetrics and gynecology care that we provide for women, the counseling, the social work, the operating room services. All of those things, along with our great nursing program, really come together because we work so well together to provide excellent care for the women of Milwaukee.
Aurora Sinai actually is the place that had one of the first ACE units, or acute care for elderly units. In the country, we were one of 20 initially, and that's a place where we focus on interdisciplinary care. Originally for older adults, now it's a mixed unit, but the goal is not just looking at the patient's medical problems, but looking at their whole picture. Easy Street here at Aurora Sinai is another really special treasure we have. It's a special area of the hospital that's designed both to work on rehab for older adults, young people, inpatient and out. So for example, they have part of a car where people can learn how to get in and out, transferring. There are model theaters there, there's a model grocery store, steps to go into a bus. So from day to day, people can learn how to do these practical things they need to carry on their lives in the community.
I think what makes the Sinai community most special is that we actually choose to do this work, and it shows in the commitment that we have to our patients. Even on tough days, there's always encouragement. There's always something that makes you feel like you served a purpose that day. And when you can leave knowing that you made a difference for someone, that's special.
Sinai is a really special place. People really come to work at Sinai because they want to work with our patient population. They want diversity. They want education. They want to be able to share that, both to take better care of the community, but also to share it with our up-and-coming students and physicians. And I think what that means is that most people come and spend their entire careers at Sinai. Lots of our providers have been here for 10 years, 15 years. We've got providers that have been here for 25, 30, 40 years and have came here for their residency and then never left.
I think Sinai just has a tremendously bright future, that we are positioned so well as downtown's hospital that as Milwaukee is really having a resurgence, Sinai really is coming along with that as well. So when I look and I see opportunity of all of the facilities in our market, I see tremendous opportunity here. So strong growth plans, high expectations for what we need to achieve, but I know that we've got a team that's going to be able to do that.